Yes, yes, yes.
Yes, I have arranged also the Arabic translation as well. So what I will give information when also someone has also some problem to understanding, then also the or Miss she will translate. Yeah, Miss
Yes,
Roli.
yes, yes, please. That would be appreciated. Dr. Zahida, I would like to introduce Ms. Rima.
Assalamu alaikum. Hello, Dr. Zahida. Thank you for joining us.
Thank you for inviting me, and it is a pleasure to talk to you people. I'm also the consultant gynecologist having 35 years or more than that experience in Austria, Vienna, working as a consultant. And here I'm busy with as a head of department and also the consultant as a Ghanaian. And I had this very unique experience. It is not the old concept that gynecology is just to treat small bleeding points or deliver the babies. The concept of the gynecology is very broad now, that it includes only the first half of the life of the woman and the second half of the life of the woman. Both are very, very important. And especially also the information for the breast cancer is very, very important for the young woman, and that way that are the future women and future mothers. They should have the proper information about that, not only for themselves, but also they can convey to their family members and also the aunts and also the moms and everybody how to get rid of this also the cancer of the breast. So we can start, or are we
Yes,
how to it?
Yes, we're ready to start. Miss Iman and Miss Desiree, they're the social workers of the school. They will also be with us, and they're the co-host of the event. So I will leave, they will take the lead from now onwards, and you can start, please.
Okay, we can also, I will wait for the Mrs. Rowley as well. In case somebody has this Arabic translation, then we are ready for that. Okay,
Sure.
Just a few seconds, she's coming.
All right, sure.
So, I met also busy at the Medeor International Hospital in Alain, in a Sharjah. And Alhamdulillah, it's a well-equipped hospital, not only for the gynecology, other specialties are also there. And we have the well-equipped surgery, well-equipped also the operation theater for deliveries and for the small baby, newborn baby station, and also the premature baby station. All that's the well-equipped hospital. I need the Mrs. Rowley. She's going. So Alhamdulillah, so I'm practicing here, and so the maybe you can see on the Facebook. Alhamdulillah, so the various the well played our patient. Assalamu alaikum. No voice. Can you hear me, please?
Yes, Doctor.
So assalamu alaikum.
Alaikum assalam wa rahmatullahi wa barakatuh.
So Dr. Zahida Choudary, and your name?
My name is Iman Ilyas. I'm the girls social worker.
Oh.
And Ms. Desiree Raji for the boys. She's the social worker.
Okay. Now the Mrs. Rowley is also joining me. Okay. If someone has a question or explanation in Arabic language, so they can ask as well.
Okay,
right. We can.
Yes.
We can start.
Yes.
Yes, I think we can start.
Yes, please.
Doctor, please.
So I will. She's working.
Dr. Zahida, you have been added as a co-host. You may share your screen, please.
You can do the screens. I think the students are on
Sorry.
Where I will see
See this.
my PowerPoint.
This is the PowerPoint.
Okay, fine. You can divide. They can't see me now. It's okay? So, can you hear me? They can't see me. You can divide. It is okay like that.
Yes, Doctora. Yes, Doctor.
Mm-hmm. This is okay. This should be. This is not for me.
Askudam, not Medeor. Askudam now is able to see.
This is Iman. Are you
Yes.
able to see me?
I can see you, but you are not sharing, Doctor, right now. You cannot see anything. Are you sharing something?
Yes.
No, nothing is here.
Actually,
I think we
you
need to
provided
mention this, Dr. Zahida. A few seconds ago, your presentation was visible, but after which it just went off. So maybe you just have to see what was the previous step you did before this. We could see your presentation briefly for a second.
now able to see Dr. Zahida.
Yes, yes,
We
we are
can
able to see Dr. Zahida.
Okay.
Can you
while,
share it
we are
again? Yeah.
now.
Yes, the
Yes.
presentation is viewed.
Now.
Yes, yeah, it's fine now.
Okay. Okay.
Okay, fine. So, Assalamu alaikum wa rahmatullahi wa barakatuh to everybody. Good afternoon. Afternoon, Sahan. So, I'm not able to see you, but we are, so you can see my presentation. So, today we are talking about the breast cancer and screening. The breast is very, very important and also the precious organ of the woman. And the breast care and the breast examination is also very, very important for the young ladies, how to examine that and how to check that. And this message, what they are taking today to their homes, maybe also the healthier aunts, mothers, and also the family members, female family members, how to take care of their family members, just to stay away such evil as a disease, breast cancer. Breast cancer is not only also the local breast cancer, it is before appearing in the breast. Just keeping this point is in mind that before appearing breast cancer very apparently in the breast, maybe it has spread already to the other organs. Because the blood supply to the breast is also communicated with the blood vessels of the other organs. So I have my experience and the some of women, especially also the lymph nodes, the oda, the surrounding the breast is also the source of spreading the breast tube, breast cancer anywhere. The target organs can be spread to the brain, can be liver, it can be the bones. So it is very important to check the breast regularly. And there are some Risk factors, we will discuss it today, and also we will see internationally, one woman among the age is suffering from the breast cancer. The reason to give the full information about the breast cancer, that should be tumor anywhere, not only the breast, anywhere in the body, in the skin, in the other internal part, or the breast. The basic rule is that early diagnosis and treatment. So when there is tumor in the breast, a tumor anywhere in the part of the body, please consult the doctor as early as possible. Don't delay, don't be shy, don't hide, don't be ashamed that maybe what can happen. Why should I share with the doctor? Why should I share with my family members? Don't be shy. Discuss with your elder parents, or the aunts, or the mom, or any other family member, female family member, to whom you can also discuss and show. So what are the common symptoms which you can detect in the breast? You should look for the lump, any abnormality in the breast. How you can do? You can see your breast, so just in the washrooms, stand in front of the mirror and compare both breasts. Both breasts are same size, nipples are fine, or these are not looking the same size. Or there is some the lump is also you can see, or you can palpate, you can also touch with your hand. And it can be, the nipples are also very, very important. Maybe underlying tumor is there and it is affecting the shape of the nipples. The nipples can be pulled in. Pulled in means the tumor is under the skin, is not appearing, but it is affecting the nipples and pulling the nipples inside. They are distorting the shape of the nipples. Or there can be dimpling of them. There can be dripping of that. Or there can be redness or rash on the skin. So their skin changes are as important as the mass. You have to check for that regularly. So the warning signs are pain in one spot that does not go away, continuous pain. Don't be scary, because the breast pain can be premenstrual tenderness. Premenstrual syndrome is also there. This is because of the hormonal changes during the menstrual cycle. So hormones in the body of the woman are bringing the number of the changes in the breast. It can cause, for example, the retention of the fluid in the body, in the breast, in the brain, in the other part of the body, which cause the woman before menstruation little depressive, fullness, and also the breast pain. So don't be very scary and get into the anxiety phase that maybe I have the tumor. So these cyclically mean before getting the periods, maybe you have the breast little tenderness. But what I'm talking about, that is pain in one spot that is continuous hurting you. It is either before the menstruation, before the periods, or after the periods, it is staying there. Be careful about that and be checked by the doctor. Maybe there is a redness of the change is the color of the skin, and it can be the size of the breast. Both breasts of the different size. One breast is getting larger or asymmetrical. There can be dimpling of the puckering of the skin, and sometimes it can also appear like as the woman have the itchy and scaly sore and a rash on the skin and the nipples. Sometimes the woman can have discharge. It is not a milky discharge. It can be a simple serous with the blood discharge. Sometimes it is the nipple is pulling in and change the shape of the nipple. So all these are signs that you have to be very aware of that. Not only the lump in the breast check your axilla, armpit as well. Armpits both sides, you have to also feel with the left armpit with the right hand and right armpit with the left hand, and check for any enlarged lymph nodes. Lymph nodes is loca de lymphaoia. So these are the very important. Inshallah, I will be going to tell you how to palpate that tumor and what's the reason for the enlargement of also these breast and tumor. So what is the reason for the breast cancer? The reason for the breast cancer, it can be also the family history. When there is also the family history of the breast cancer, the next important point is that your mother or aunt, maternal or paternal side, in which age she got that breast cancer. If in the early age, that is more also the serious, and you have to be checked up by the doctor and also for their investigation as early as possible. So secondly, why the breast cancer? The reason for the cancer is still not known. Not only breast cancer, the other cancers as well. So the genetic mutation is there. That is one of the reasons for that. How the genetic mutation is occurring, this is a big question mark. And so we should be aware of that we are living in a very dangerous world nowadays. Electromagnetic changes are, and the surroundings are not so safe as well as it was in the past. Who are at more risk? The women who are obese, who have big breasts. These breasts are very, very dense. They have also the glandular tissue. So these dense breasts are more at risk because it is difficult to detect any small tumor very early phase. And prolonged use of the hormone replacement therapy, especially for the women after the menopause, they are at greater risk because the breast tissues are hormones dependent. Hormones dependent. So we should also have to take care of that. Any woman is taking the hormone for a long time. If you have someone have the more also the kids is more protected. Who has more also the more given time to feed the baby with the breast milk is more protected. So obesity and the the breast size is at risk. So we have discussed genetics and the family history. This is very important. And how you check that. I will show also these different sizes and different shapes, which you just, this is just the breast skin is just like the skin of the orange. It is not smooth. So changes even like that are very, very also the dangerous and should the skin rash like that. This is also the protecting of the nipple. Nipple is not outside, it is inside. Rash again. Very red area with the mass. So in front of the mirror, just compare the size of the breast. How to rotate? So you just check your breast. When to check the breast? Just after your periods. Just in the circular form, raise your the arm and palpate, and in the wedges form from the outer to inner side. Then in the line forms. Just check that, and you have to also soon after your period, you will check your breast. In lying position, how to do that? You can, the line, this is lying position when you are lying on the bed or on the smooth surface. Then on the circular form, then the axilla, armpit, you will check that. So the breast is consisting of also the fatty tissue and the fibrous tissue and the ducts. Because these are the different kind of also the tumor can appear at different area. What you can do, you can also ask for the ultrasound. Ultrasound, you can detect some cystic masses, and the combination of also the X-ray, you can detect the solid masses. So these are the very so the dense breast where it's difficult to see any so the hidden tumor. In such breast, the additional so the examination or additional so checkup and also the for example the breast mammogram, then is MRI, so and the PET. All these are the investigation. This is the MRI machine. So some women are very afraid of, they have the phobia from the claustrophobia, just to lie inside some also the examination table. But now the new MRI machines are available. This is just a circle, but they can breathe, they can see. So breast is have the ducts, have the lobules, have the nipple, then the fatty tissue, and connected with the ribs, and these are the lymph nodes where the any tumor in the breast will spread to the lymph nodes and the blood vessels. You can see this also, the lymph nodes are there and the vessels are along it. From here, the breast cancer will spread to the other part of the body. Sentinel lymph nodes are somebody when she has a tumor and the tumor is removed, what we are doing, remove this. So the sentinel lymph nodes are very immediate near as a lymph node to the breast. And we will also remove that and send for the histopathology. If it is positive, it means that the chance of the spread is there. So this is just a brief introduction of the breast cancer screening and how to palpate and how to do all these things. So if somebody will have question, they can ask. I will just give us, so we go through all these slides. You can see signs and symptoms, how the exposure, risk factors, and statistics. So we can start.
Yes.
It is a short time, but it is just
it's fine, I think. إذا في حد عنده سؤال تفضلوا ممكن تسألوا. If you have any questions, please you can ask.
They can also type, Ms. Iman, you can say that in Arabic. They can also type the message if they want.
Okay, إذا حابين ممكن تسألوا ممكن تكتب على الشات بوكس.
عادي يا صبايا، إذا في أي سؤال حابين تسألوه حتى لو سألتوه بالعربي أنا بترجمه للدكتورة.
Okay, can I paste Ms. Wajiha now?
Yeah, Iman, I think we need to translate that. Somebody asked a question. Or...
No questions, they said that.
No questions. No question were good. No question is, they should ask some question. They should be
no questions.
ما في أي أسئلة، ما في أي شيء
ما في خجل البنات، اسألوا عادي، وحتى أولياء الأمور تفضلوا إذا في أي أسئلة الدكتورة جاهزة لتجاوبكم.
Don't be shy. Any question you have, you should ask, because for one question we maybe make your question may clear the question of many others. They understand as the.
Okay. والسيدات أولياء الأمور في أي سؤال بتحبوا تسألوا؟ Any questions, our dear parents?
Okay. Special message for the young ladies that which I already emphasize on that the breast tenderness, breast pain before the periods is because of the hormonal changes. So they should not rush to the hospital that maybe they are developing some tumor. So pain is not the first sign of the breast tumor or breast cancer. But if their doubts are there, they should consult the doctor, definitely.
Dr. Zahida, there is a question one of the people would like to know, which says, will breast cancer affect the time of menstruation?
No, these are the two different areas. The menstruation is under the control of also the hormones, and these hormones are ovarian hormones and the brain hormones special. So the tumor may be there, but it is not also the affecting the periods. The tumor or the breast cancer can be or cannot be hormonal dependent. Some tumors are estrogen and progesterone receptor positive, but some tumors are not receptor positive. So hormone receptor positives are not there. The tumor, breast tumors, who are the triple, we say triple negative tumors are more aggressive. So when the hormone receptors are there and the tumor is receptor positive, we give the anti-hormonal treatment. But when it is triple negative, so these tumors are more aggressive. So with the increasing the number of the different kinds of the investigation, in the last period, we are also detecting different receptors. This tumor, for example, also any woman when have the breast cancer, we are also trying to detect that the tumor is either receptor positive, mean hormone receptor positive, estrogen receptor positive, progesterone receptor positive, or not. If positive, it is as a good prognostic factor. If it is negative, it is bad prognostic factor. There are also the Herceptin factors and many, many other. I will keep my lecture, so the talk very simple. So receptors, the hormones are affecting the breast, but breast cancer is not affecting the periods. Any other question? Special message for the mothers that also when they are also the 50 plus. So please have a regular checkup. I hope that also especially also the locals, they have also the SEHA, they are also calling for the mammogram and the breast ultrasound. Keep in your mind that also the checkup, the always is the combination of the breast ultrasound and breast mammogram. What is a mammogram? Mammogram is the X-ray. What is ultrasound? This is a simple ultrasound of the breast. So combination of the both will give the appropriate also the diagnosis, which we are calling the radiology, also the BRAD. So this is the abbreviation that is the classification of the American School of Radiology, that they have classified how we can express our also the diagnosis according to the findings of the breast, so the X-ray and breast ultrasound. So if it's a BRADS1, as BRADS2 is also the fine, everything is okay. 3 or 4 detectful as something doubtful. When the breast is too big, then it is difficult to see something, so it needs further evaluation.
Okay, Dr. Zahida, there is a continuation to that question.
Okay.
I want to say, I'll finish this, Ms. Iman, and then you can
all
continue.
right, no problem.
Yeah, it says if the underarm has some fat under, is that a sign to check at the doctor or not?
That's a good question. Underarm fat should be checked by the doctor. That I talked before. When the woman is overweight, when the breast is quite big, it is difficult for the woman to check that either some tumor is there or not. Similarly, when the armpit is very full of fat, it is also difficult for the woman to detect herself. In such case, please take the help of the doctor. Yeah. So it can be in simple fat, it can be some enlarged lymph nodes under that fat. So check up by the doctor, and additionally ultrasound and also mammogram is very, very important.
Yes, Miss Iman, you can continue with the next question, Miss Iman. It's in Arabic.
Yes, you know, it's in English, but I saw one question here, Doctor.
In Arabic.
This
Yes.
one in Arabic. The first one, it was in English.
I've finished already. Yeah, we have informed.
Okay, in
she
Arabic.
answered that.
Okay.
Yeah.
اوكي مساء الخير. بدي اسال عن الفحص الذي تعطل بالبيت عن الدورة. اذا تعطل ايوه.
عفوا حبيبتي ممكن تعيد السؤال؟
اوكي لحظة راح اعيد لك السؤال. اوكي بتسأل عن الفحص اللي يتعمل بالبيت بعد الدورة ولا قبل. The test should be after the period or before. I think it's after, yes. Right?
Yes, quite right. You listen that lecture quite carefully. That's correct. Why? The same which I said before, that before the menstruation, there is, because of the effect of the hormones, retention of the fluid of the body stay in our body. So it is not the right time to palpate breast. After the menstruation, all the things are going down, no fluids inside the body, no any the edema, and so you can palpate. That is the standard. Soon after also the menstruation, after the period, you can check your breast every month. That is very, very standard.
Miss Iman, maybe you can translate that for that particular parent, or the other the translator with the doctor.
هلا عزيزتي هي الدكتورة عم بتخبركم انه عادة احنا ما بنفضل الفحص انه يكون قبل الدورة. ليش؟ لانه قبل الدورة الوحدة بتكون جسمها زي ما بنقول احنا بالعربي منفخ، بيكون فيه احتباس مي بالجسم، بيكون صعب على الوحدة انه تعمل فحص دقيق لصدرها. فبعد الدورة ما تخلص يعني بكم يوم بعد الدورة بيكون رجع الجسم لطبيعته، راح التنفخ اللي بالجسم. فوقتها بس تيجي الوحدة تعمل فحص لصدرها بيكون سهل عليها لأنه خف الورم وراح إنه تشوف أي شيء مش طبيعي بصدرها. واضح كلامي؟
Everything clear?
They said that they need request for what? شو المطلوب؟ ممكن تكتبوا بالعربي ما في مشكلة.
Feedback through this form. Thank you for attending this session. Okay. So, Mrs. Iman, so you can suggest.
Yes.
Any question from our side? Any question to us?
There is one request, but I don't know what. I will unmute all. Okay.
It's Nasra Faisal, so you can
Yes.
unmute Nasra Faisal.
Miss Desiree, also you can help me please to unmute all.
Yeah.
I open. She can talk now.
She's also. Okay, it's okay. She's asking about the link.
Yes,
she's
the link.
Yeah,
I put the link here, so you can, if you have anything, you can just write it in the follow the link and type everything you want at the end of this lecture.
This is one more.
اللينك أنا في رابط تقدروا إذا عندكم أي استفسارات أو أي شيء تدخل على الرابط وتحطوا استفساراتكم.
So I will for the young ladies, I have a number of the young patients. They are coming. They have palpated something. They felt something in the breast. Most of the time, it is benign. It's called fibroadenoma. So it can be seen as in ultrasound. It does not mean to undergo surgery. This is a simple message because nowadays, as I said before, the investigations and checkups are so precisely that we can see this is the doubtful tumor or this is the not doubtful tumor. This tumor needs biopsy and the other tumor does not. I never recommend just to remove the whole small fibroadenoma if it is there. Why? Because when you will go under surgery, surgery will leave some adhesions. What is adhesions?
التصاقات زي تخلي التصاقات.
And if there is development of any fibroadenoma in the young lady, it will be difficult to differentiate, and maybe it is difficult to classify that it is not as the bad one, it is the good one. So please just observe. If it is necessary to do that, then there is also availability of the needle biopsy is here. We have the very good surgeon. We can do the needle biopsy. We can do the ultrasound guided, also the ultrasound biopsy, MRI guided by needle biopsy. So all the availability, MRI, then also CT scan, ultrasound, Doppler ultrasound, operation theater. So all these things are available at Medeor International Hospital. We are in the area of Asharaj, well equipped and well, also not only also I'm talking about the breast cancer also and the breast tumors. We also have for the young lady, married lady, for delivery rooms, and also the NICU for the neonates, for the young, that's very, very newborns. We have the special also the wards. So all facilities are available here. We have the orthopedic services. We have also the surgeon, surgery, ENT, ear, nose, throat. All the specialties are there, and you can visit us at any time. Yes, please.
Ms. Iman, there is one person who's trying to talk. We're trying to you need to unmute her. 1 minute. Let me see if I can. Okay.
Yes,
Yes.
you can unmute
your
co-host.
That someone has
you can talk right now. You can unmute yourself because we have given you the permission. If you have a question.
Someone has asked that how we can also prevent that tumor. That's a very, very good question. This is also as the other tumor I told that also what is the etiology is we can find out if there is the family history, if the tumor is there, just with the healthy food and reduction of also the overweight should not be there. And healthy food means that there should not be also the junk food. There should not be also the processed food. And just keep your weight. Simple formula. If someone is under 60, you just deduct 100. 60 is normal weight, -5 is the ideal weight. So 160 centimeter will have the ideal weight 55 kilo, normal weight 60 kilo. If you are overweight, please reduce your weight. Extra fat is a risk. Extra big, large breast is a risk. Abnormal, also the hormone intake is a risk. So all this as exposure to the radiation is a risk. Spend your life, healthy life, and I'm always against the junk food, especially the fast food. Any more questions?
No more questions?
No more questions? Okay, they said, yeah.
Okay, they said thank
Dana
you.
8 says, thank you very much, doctor. She thanks you for answering her questions.
Just a simple message is they stay away from the fast food. I know. It is very surprising when the women are coming to me, especially the pregnant one, and say, okay, no this food. And they just hang their face, but husbands are very happy because they will save their. So just as you are as the young girls and as the future mothers and future as the take as the healthy. this is very important. What you are eating, so your body will make from that genetic material. So genetic mutation will be there, whatever you are, because we are exposing to ourselves to radiation. Then also the abnormal food intake, also the full of also the meat today, what we are also the getting in the market is the animals are given the full of steroids to bring the animals in the market as early as possible, just to stimulate their growth. Similarly, also vegetable and fruits are not out of that because they are spraying chemical just to increase the shelf life. So be aware of your food. I will emphasize just eat organic food, grow your vegetables, grow your fruits at your garden yourself. It will be amazing for you and it will keep you healthy. This is my take-home message. It will keep you from the cancer as well.
Ms. Wajiha, is there any questions for the doctor or Ms. Iman?
Yes.
Ms. Wajiha still here?
No, I think Ms. Wajiha, she's not here.
Okay, any more questions, ladies?
So thank you very much, Dictora. Thank you.
Welcome.
For your time.
And thank you very much, parents and students, for coming in and listening to this very important topic, which will help you all down the line.
شكرا لكم جميعا، ولا تنسوا إذا في أي ملاحظات ممكن تكتبوها على اللينك. ونشكركم جميعا الطالبات والسيدات الأمهات، شكرا لحضوركم وشكرا لكم جميعا.
If they want to have the one-to-one counseling, they can visit me here in the Medeor International Hospital.
You can translate that, Ms. Iman, if you need a one-to-one counseling.
Yes, Ms. Desiree, I cannot hear you.
Doctor said if they need a one-to-one counseling, they can visit the clinic. So you can translate that for the parents.
اهلا وسهلا. هون باي وقت هون دكتور زاهده موجوده، مستشفى ميديور بعشاج منطقه المرخانيه. مرحب فيكم باي وقت هون عند دكتور زاهده.
Thank you very much, doctor, and thank you for translating also. Thank you so much.
Thank you very much for it. It was a pleasure.
شكرا.
It was very informative. It was very informative. Thank you so much.
السلام عليكم.
مع السلامة.
Thank you, Ms. Desiree.